Hello everyone, and this will be our video on some diseases of the musculoskeletal system, the combination of the muscular and skeletal system. It'll be longer than typical because we are essentially talking about two different systems which are so closely connected that they're often paired as one single body system. Muscles, skeleton, things like that. Well, muscular skeletal, skeletal muscular system. There are some diseases and disorders. Some more common ones include osteoporosis, osteoarthritis, carpal tunnel syndrome, or some more rare ones, which will be fascinating to get into: osteopetrosis, achondroplasia, Ehlers-Danlos syndrome. And let's get into those guys. Osteoarthritis is a degenerative disease. It gets worse with time, leading to chronic joint pain, often making common tasks difficult, like moving around, closing and holding something in your hands, things like that. It's the most common type of arthritis, inflammation of the joints. This occurs due to deterioration of the cartilage tissue, which again, since it has no veins in it, it's hard for cartilage to heal. The cartilage is meant to help cushion the ends of bones. So as that deteriorates, that helps give wear and tear on the bones itself and the connective tissue within the bones and between the bones. Some preventative measures include there is still more study that needs to be done, but there are certainly some cases that have been shown where making collagen as part of your diet helps to prevent or has been correlated to lower instances of osteoarthritis developing. And well, if you have an injury to the cartilage, you really should allow proper time for it to heal. Say you go to work and you get a nice injury to some cartilage in your knee, it really would be better to, if possible, get proper workman's compensation time off to allow that to heal. Otherwise, if you keep using it while it's damaged, that encourages it to become even more damaged, as opposed to it simply healing with time. And if necessary, surgery can often help, like in the case of cartilage being so badly damaged, whether through infection or other instances. Surgery can help with knee replacements, and more often than not, pain medication will definitely be needed. Now, osteoarthritis, that was basically inflammation of the connective tissue of the joints of bones. Osteoporosis is effectively affecting the bones themselves. So going from like the muscular side to the skeletal side with osteoporosis. It can also be called porous bone disease, and it is slow and progressive. It gets, again, worse with time. It affects bone density, and the quality of the bone itself will diminish along with the density of the bone. So the bones become more fragile, resulting in the bones to become more porous, filled with holes, more brittle, more susceptible to breaking and fracturing. This is most common around the hips, wrists, and spine, and oddly enough, it being someone who would have more weight, that extra pressure actually helps prevent osteoporosis. It helps keep pressure on the bones, encouraging them to heal and stay strong. Therefore, certain sets of the population who are typically lighter in weight will often have more osteoporosis incidence, like women who are white or Asian background, particularly after menopause, where a lot of the body functions start changing. Those would be groups of the population with higher risk and highest risk of osteoporosis developing. Some preventative measures include having a healthy diet of the minerals and nutrients you need, and even doing weight-bearing exercises, doing weights, carrying things around. In my particular suggestion, if you're an uncle and or an aunt, lifting your nieces and nephews, chucking them around the couch, that definitely helps prevent osteoporosis, as I can definitely testify. Treatment based, as far as treatment for osteoporosis, treatment is based on really the likelihood of a future bone break. So however along your osteoporosis is, your treatment will vary depending on how likely you are to cause another break in your bones. And, well, after doing a bone density test, there may be medication given to help with the bone structure, or you would have to be suggested an alteration of risk factors, like maybe try exercising with lifting weights or heavier objects more, or avoid the potential of being in places where you are expected to bump into a lot of people, or slippery surfaces where you might fall and break weaker bones. Carpal tunnel, that's a syndrome that is common in people who do a lot of repetitive work, especially those who do a lot of keyboarding, people who file claims for Medicare, Social Security, or anything that involves being at the computer for many hours at a time. It is a condition that causes a lot of pain and eventual numbness and tingling in the hands and arms. Typically that's where you'll see them, because fingers will often do a lot of repetitive motion, just as the wrists. And this is due to damage from excessive compression to the median nerve going in your arm and wrist. Oddly enough, there's more space based off of the structure of the hands in men. Women are actually more likely, based off of how their hands are structured, to develop carpal tunnel. And women with CTS generally have smaller than average carpal tunnel areas. Or I should say, women with carpal tunnel syndrome typically have smaller than average carpal tunnel areas. Now, oddly enough, where having heavier weight would help prevent osteoporosis, having heavier weight actually is a risk factor for developing carpal tunnel. So it's a double-edged sword. Either it helps you or it hurts you. And there are inflammatory conditions that can develop, such as rheumatoid arthritis of the tendons around that area of the wrist. And preventative measures will be as simple as taking care to not do activities that strain the wrist for a long period of time. So if you're typing for a long time and your fingers are moving in a typing fashion, take a break, a few minutes or whatever, move them in a different format than what is typical. Maybe move your wrists in a different direction than what you were using the entire time. That is a very effective way of actually reducing your chances of carpal tunnel. But if you do have enough damage given to that median nerve, well, then surgery will be needed to help repair, fix, move things out of the way to help repair that nerve. And then it will heal with time. The median nerve, actually, even well into your 50s, you still have the ability to heal from a carpal tunnel surgery. So if you ever need to and you find that you develop it while you're older, definitely still go for the surgery. You will have plenty of time to enjoy higher quality of life after it heals, regardless of your age. Now, one of the more rarer diseases, not something that the vast majority of us will even ever get to see or meet someone who ever suffers through Osteopetrosis, or stone bone or marble bone disease, where the bones become abnormally dense and stiff. It's sort of like the opposite of osteoporosis while still having the same symptoms. Or osteoporosis, the bones are becoming very weak, they are decreasing in density and therefore they become more brittle. Osteopetrosis causes bones to become much more stiff and less willing to give and bend. Therefore, they shatter more easily because they're not willing to absorb a shock as effective as a normal healthy bone would. There's the autosomal dominant version. So basically, osteopetrosis, this is inherited. And if you have the autosomal dominant version, which is the mildest form, essentially you get a dominant gene from one of your parents. Patients typically don't discover they have osteopetrosis until getting a routine x-ray to look and measure the density of the bone. It can lead to conditions like scoliosis, curvature of the spine, because the bones have less give, less ability to move around because they are more dense. But again, this is the more mild form, so most people will not actually know it until a trained professional actually happens upon it while looking at an x-ray. Now, the autosomal recessive version, where you get essentially both recessive genes from both parents, much more severe and much more easy to recognize before you ever go to a doctor. In fact, typically these can be even observed during infancy. Simple bumps and falls, if you fall down, that can be enough to result in bone fractures because those bones are so stiff that they will not absorb the fall of you falling down or you bumping into a corner of a door too hardly, and those bones will shatter and fracture. Can lead to abnormally high bleeding because you're damaging your muscles, the veins going throughout. Bones are a source of hemopoiesis where blood cells are made, therefore those get damaged. You're definitely going to see blood leaking out. And, well, in turn, even if it's only a little bit of blood leaking out here and then, that often causes anemia because you are losing a lot of your oxygen-carrying red blood cells, or less of them are still in your bloodstream to circulate oxygen. There is another type of petrosis which is X-linked to the X chromosome inherited from the maternal side. In addition to heightened bone fracturing, so increased rate of bones breaking, the X-linked osteopetrosis includes lymphedema or fluid buildup in the lymph nodes and anhidrotic dysplasia, unusual development of hair throughout different parts of the body, including excessive hair or a atypical, unusual pattern of hair. Instead of it being even across certain parts of the body, it might show up in patches. And it also affects teeth and sweat gland tissue. So it's quite a gnarly thing to experience if you get this X-linked rare version of a very rare musculoskeletal disease. Continuing on to another rare one is Achondroplasia, which is an autosomal dominant disorder. So you have to only inherit one gene from one parent and it will give you the disease. And it affects the healthy conversion of cartilage into bone. So there are some points where as your metaphyses in your long bones are growing, they're growing cartilage that eventually ossifies, that hardens into actual bone. Essentially, it puts the metaphyses of long bones at risk because it hampers the ability to extend the diaphyses with time. Since it affects the areas of your body that grow during puberty, and the growth of cartilage into more bone, it can cause a variety of issues like macrocephaly, or a large head disorder, apnea, interrupted breathing while you try to sleep, thus having another host of issues like sleeplessness, hard of sleeping, feelings of choking while you are trying to enter deep sleep, and thus waking you up before you can reap the benefits, lordosis, which is a very intense inward bend of the spine. So, where scoliosis is more or less side to side, lordosis is front and back, bending in the ventral dorsal directions. And then there's hydrocephaly, which is buildup of fluid in the brain, very very bad, adds a lot of pressure, and since it affects the bones growing, this is where a lot of people who go through dwarfism, who are unusually shorter in stature, they will typically have some form of achondroplasia at work. And then another one, this one, not so much the bones, but this one really affects connective tissue. So the muscles and the connective tissue of the musculoskeletal system. Ehlers-Danlos, a rare condition of which there are a variety of different types. It is inherited and it affects the connective tissue. Ehlers-Danlos consists of more or less 10 different individual disorders, which are all called Ehlers-Danlos, but they all vary in severity and what are infected. And they affect essentially the normal motion of joints and limbs. The more milder versions, which are actually more nicer to have, lead to hypermobility, or you might call it double jointedness, where essentially the skin and the joints have a higher than average stretchability, yet it's actually an effective, it's actually a benefit, that kind of greater stretchability, so less likely to break something or to pull something if you are moving too quickly or reacting too quickly. On the other end of the spectrum, the forms of Ehlers-Danlos, which are more severe, they have a whole host of conditions that can affect the body, such as those that affect your ability to properly store collagen, therefore you become collagen deficient, which weakens connective tissues. There are some versions that essentially cause weak blood vessels that make them more prone to bursting. There are some that affect the connective tissues that keep bones together, which can cause, say, your shoulder bones to pop out of socket, or your legs to pop out of the hips more easily. And there are some that cause your skin to become much more stretchy and fragile, to the point where it can actually peel off, break, bruise much more easily than what is actually helpful. Like a little flick, like a little, in some cases, just a acorn falling can cause a severe bruise, a very severe bruise. And then there are some that are autoimmune, that cause autoimmune inflammation. So basically your immune system will be attacking your own body, causing even more damage. And then there's kyphoscoliosis, which essentially the spine is bending, more or less in a three-dimensional direction. So forward, backwards, side to side. There's quite a lot of issues if you have kyphoscoliosis. And well, severe versions are more often prevalent. You will more often have a severe version of Ehlers-Danlos if you do have Ehlers-Danlos syndrome, EDS. And very often will have some, and well, they can be autosomal dominant. Basically, you inherited a single EDS carrying gene from one parent, or they could be recessive, where you got genes from both parents, which would not actually, which would actually not lead to EDS if you had only inherited one of them. I happen to benefit from only having the more mild versions, which allows me to survive doing a lot of flexible maneuvers. So that's why I included EDS into this rare segment of the diseases of the muscular skeletal system. And well, getting toward the 21 minute mark, it is a pleasure to have given you guys the diseases of the musculoskeletal system. Looking forward to getting into the other systems as well. So, well, at the 21 minute mark, 21:50. See you all in the next video.